Hospital Authority Chief Manager. I will invite Dr. Chuang to update you on the COVID-19 outbreak, and then Dr. Ho would also speak. Dr. Chuang, please. Today, we have one confirmed case, a male aged 43. He's a private pilot. In March, he flew back to Hong Kong. On the 15th, he came back to Hong Kong from London. Prior to the 15th, he had been to the USA and France. He returned to Hong Kong on the 15th of March. On the 16th of March, he left Hong Kong and went to France. On the 31st of March, he came back to Hong Kong. On the 16th of March, he went to France, and 2 days later, he had a fever. On the 16th of March, he had fever for 2 days, and then he recovered on his own. He didn't see a doctor while in France. 2 weeks later, that is on the 31st of March, he returned to Hong Kong. Thereafter, he didn't show any symptoms. Recently, on the 9th of May, he consulted a private doctor who would like to test for his antibodies. So IgG is positive, IgM negative. On the 13th of May, he was engaged in some water activities in Lantau on his own. He hurt his finger, and therefore he was admitted to the North District Hospital and later Princess Margaret Hospital. He was tested, and he was tested positive, although the viral load was very low. So on the 15th of March, he came back to Hong Kong. He stayed for 2 days. He met his girlfriend. That is on the 15th as well as the 16th. On the 24th of March, his girlfriend didn't feel well. Towards the end of March, she was confirmed, and she's case 743. At that time, we weren't aware of this current case, but at the time the girlfriend was confirmed, there was contact tracing. On the 24th of March, the girlfriend did not feel well. On the 16th of March, she met her boyfriend. So at that time, we thought the boyfriend might have been a source. So upon his return, we invited him to be tested to see whether he could have been a confirmed case. In the middle of April, he was tested negative, and therefore he wasn't a confirmed case at that time. But it is understandable because already almost a month's time has been passed. As we are aware of his history, as well as the history of the girlfriend, so it might be a suspected case, and so he went for an antibody test, and he was tested positive. He was admitted to hospital for something else, and again he was tested positive. He spent most of his time at home while he is in Hong Kong, other than making a few trips outside. He lived in Tung Chung, Block 5 of a housing development. Most of the time he spent his time at home, but from time to time he would visit supermarkets for a few minutes on each occasion to do some shopping. He didn't come into contact with many other people. On the 9th of May, he had a meal with his girlfriend. That's all from me today. Dr. Ho, please. Good afternoon, ladies and gentlemen. As of noon today, for the past 24 hours, the hospital authority reported 16 cases. Together with those already hospitalized, we have 56 patients still in isolation for treatment. For the past 24 hours, we had 10 patients discharged because they have recovered. So far, 1,019 patients have recovered and discharged. As of noon today, among the 29 confirmed patients staying at 9 different public hospitals, 1 of them is in critical condition, 3 in serious conditions. and they are the cases we referred to before. 25 are in stable conditions. As of 9 o'clock this morning, we have 1,251 negative pressure beds and 73 negative pressure wards, same as yesterday. The utilization rates are 39% and 54% respectively. I would like to supplement to what Dr. Chuang has said. The patient attended the A&E department of the North Lantau Hospital. He was admitted to the orthopedic ward. To play safe, his blood sample was taken, and it was a positive outcome, and therefore the orthopedic ward staff members transferred him to an isolation ward for isolation and treatment. And we are now testing his we are having a serological examination again. Throughout his stay at our hospital, he put on a surgical mask, and he didn't have any upper respiratory symptoms. While he was staying in the ward, he spent about 30 minutes time. Thereafter, he was arranged to go to a cubicle on his own. Throughout the stay, he wasn't given any high-risk procedures. Our staff members took nasal samples from him. At that time, our staff members put on appropriate PPEs with an N95 respirator and a face shield. The hospital has now arranged for a cleansing up of his ward. We have also explained to our colleagues as to what happened. So far, we haven't got any patients or colleagues who will be deemed as close contacts of this person. In addition, today I would like to talk about the stock of our PPEs. As of the 15th of May, that is today, we have got 27 million surgical masks, 2.3 million N95 respirators, and then 3.6 million protective gowns. And then we understand that in such a way we can last for another 2 months. The global outbreak is still critical. Some countries have banned the export of such PPEs. In particular, for N95 respirators, we are also concerned about the supply. For our hospitals, we have gradually resumed our normal hospital services. So PPE supplies are still tight. We are considering other options. We are grateful to our colleagues for being prudent in using the PPEs so that we can join hands to fight the epidemic. So much from me. Thank you.
Now please identify yourself and raise your hand, and then we'll give the microphone to you. So identify yourself first, and every time you are allowed to ask no more than 3 questions. And the lady on the far side. I'm from Ming Pao. With regard to this case, when he was admitted to PM, in which ward was he? Was there a number? And how many patients were sharing the ward or cubicle with him? He stayed in the cubicle for about half an hour, and then was he then transferred to the isolation ward? How many medical staff are put under medical surveillance because of close contact? Will other patients be tested? Will they be subject to medical surveillance? What will be done to them? Yes, for this case, I want to ask the CHP. Now, this pilot, is he regarded as a local case? And where did he got the illness? What is your guess? And is it was he the source of the case? Did he pass the illness to his girlfriend? And my next question is on the Tsuen Wan cluster. Now, several blocks of buildings and several tuition classes. How many of them have the test and how many positive, how many are still waiting for the result. And what is the direction of investigation? First, on the patient, the particular patient. At the A&E department, we check his condition. In the past 14 days, he didn't have any travel record, and he didn't come into contact with confirmed cases. The orthopedic doctor asked whether the patient had URLT symptoms. The answer was no. And because of that orthopedic need, the patient was put in the orthopedic ward. In the orthopedic ward, the orthopedic team took the safe approach, and then the patient was put in a single room. So the patient was only in the ward for about half an hour. As for in the cubicle, there were another 8 patients. All of them had put on surgical masks, and therefore they were not regarded as close contacts. As for the number of staff members contacting this patient, about 10, including doctors, nurses, and then ward assistants. As I said earlier, they have all put on surgical masks. Therefore, they are not close contacts. As for case 1053, we think it is an imported case. The onset should be on the 16th of March, and that was in line with the definition. And with regard to 743, there was no other suspicious source. The onset was March 16, 17, and he met his girlfriend on March 15. So that he communicated the disease to his girlfriend, and she had the onset on the 24th of March. So probably the onset date of March 16 was correct. That's based on the epidemiological model. In middle of April, we tested him. He was tested negative. That was after a month of the onset. Probably the virus load was too low to be detected. And in the recent admission, he was tested. The virus load was also low, relatively. As for the antibody test, it was negative by the private practitioner. And we have also to wait for the test by the HA. And it may be a recovered case. And sometimes there may be the shedding of a low quantity of virus. As for the Chinwan cluster, we are distributing the small bottles. In Lei Mok Shue, we issued 1,900, and we recovered about 180. We want to facilitate the return of the bottles. Some boxes are put by the housing authority. We will continue to collect the boxes we provide the boxes to facilitate the collection. We hope that they will return the samples as soon as possible. We want to know all the conditions of all the residents. We have test results of 27, including those from Chek Ming House, 1 or 2 from the tuition school or tuition center, and there has been no positive findings. As for case 1052, there is new progress in investigation. Well, not exactly, but after we do checking, we identified about, through the hotline, we identified about 50 or so people who come to have their clocks or watches to be repaired. They just left their clocks and watches. And so there was just a short contact. About 30 to 40 are willing to return their samples. Sorry, speaker is not coming through. She doesn't have the microphone. I think the chance is not high. The virus load is very low. And he isn't very active, and he doesn't come into contact with many people. And his girlfriend has also recovered. He has to be infected by somebody else. It's very likely that he got the illness in overseas, maybe in the UK, and he brought it back to Hong Kong. The lady at the back. I'm from Hong Kong 01. I have a question for the latest case. 10 medical staff and 8 patients in the same cubicle. Will they all be tested? They stay in the same room for just half an hour. Have they shared toilets? What is the chance of an outbreak within the hospital? Now, the pilot has been tested several times because he did return to Hong Kong. How many times had he been tested? And were all the tests negative? Was there any problem with the testing method? What are the reasons, or what were the reasons for not identifying him as a carrier? As for the Lim Mok Shue case, a cluster, you just distributed 1,100 bottles and you only received 180 samples, so it's a rather small proportion. Is it that people don't understand how to take samples, or they are unwilling to provide samples? Is it can you compel people to receive testing, or will you send your staff to teach them how to collect samples? As for the clients of the watchman or the watch repairer, you've identified 50 or so, and just 30 or 40 will be tested. Why is it so? Why don't you do testing on the rest? Is there any chance to isolate themselves at home or isolate them in the centers? During that half an hour, he stayed in his own cubicle. I have talked to my colleagues in terms of epidemiology. In the same room for half an hour cannot be regarded as close contact. And after, the patient was put in a single room and then to the isolation ward. We did cleanse the places thoroughly. Now, he had his surgical mask on. Our staff members and also the patients also have surgical masks on, so the chance of getting infected is very low. Now, he's a pilot, so he's an exempted person. So when he comes to Hong Kong, he doesn't need to isolate himself at home, but he takes care of himself. And in fact, he isolated himself at home for 3 weeks. In the first 2 weeks, we liaised with him. We asked him not to move around and asked him to give us his sample. And then he had 1 more week to his own isolation in April. And he altogether had about 4 tests. As for Lim Mok Shue cluster, the housing department last evening started to issue the bottles. This afternoon, when we went to collect the bottles, the bottles were returned last evening. We are not able to get the return rate. It is reasonable for us to wait. We provide the boxes. We originally thought that the residents would return the bottles to the collection points. But we found we later know that it's not convenient, so we put the collection boxes downstairs for them. As for those from the hotline, contacted through the hotline, and also with the help with police, we identified 57 people they asked the old gentleman to help them to repair their clocks and watches.
我哋知道咗。
We are aware of their conditions. They don't have symptoms. Some would like to be tested. Others think that there's no need for a test. We're not going to mandate a test. But of course, for their own safety, it will be good for them to be tested. The next question. Any questions? Yes, the gentleman at the back. I'm from TVB. I would like to talk about the case of this gentleman. When he was tested for the second time, he tested positive. Would it be the case that in mid-April, since he gave his own deep throat saliva and it wasn't carried out properly, and so he wasn't tested positive? And do you think that as a result of this case, there is a need to prolong the period of home quarantine? That is, it should be more than 14 days. And do you think that there is a need to enhance the testing program so as to avoid having people being tested positive, even though there was a negative test result in the beginning? Well, on the 16th of March, there was the onset of illness. And then by middle of April, 1 month passed. So at the time he was tested negative, I'm not surprised. Earlier on, the scientific committee called a meeting for patients of COVID-19. Sometimes, as you know, the PCR test is very sensitive. So a few weeks or even a few months later, somebody may still test positive. Like the hospital authorities' patients, their test results may fluctuate between negative and positive because the test is most sensitive. And therefore, that's why we have checked the literature around the world. That is, for how long a patient will still carry the virus. Must he be totally clear of the virus before we can discharge him, as far as the PCR test is concerned, or whether it's a matter of whether the yardstick should be pitched at whether the virus can be incubated or cultivated. So if the onset was more than 10 days ago, well, the virus shedding would be very low. And then upon discharge from hospital or prior to that, we'd like to have 2 consecutive tests. If the test results are uncertain, then we'll try to check. We will look for the antibody. If there's the neutralizing antibody, then even though the test result might have been positive, it doesn't mean that he's still infectious. Just like in this case, he may always be having a small quantity of virus that can be detected. The next one, an English question. The lady over here.
Thank you from RTHK. So